Well, I am really delighted to be here with you this evening. And Alberta Health Services was created in May of 2008. I had about 10 more days notice than everybody else in the world that this was about to happen. And that's at that point that the government of Alberta amalgamated the 9 previous regional health authorities, as well as the 3 province-wide organizations as well. So I was asked to take on the challenge, which it was, of being chair of this new organization. It was, of course, a very complicated undertaking, 12 different independent organizations, 12 different general ledgers, 12 different payroll systems, 12 different, well, at least 12, maybe more different cultures within the organizations, the legacy organizations. So what I'd like to share with you here tonight, I won't speak more than my 3 hours that's allotted. I want to just share with you very briefly some insight into some of the challenges that we face in governance and in leadership in healthcare from a pretty personal experience the last 2.5 years, but also share with you a few insights on where that what we can all learn from that. Obviously, it was really important to us. I hope you'll forgive me coming to Toronto and speaking about Alberta, but I think that everybody can learn something from our experience. I know that lots of people are following what we're doing closely. We are striking out in a slightly different direction, and we're happy to do that on behalf of all Canadians. Now, so we started out by saying, you know, here we have a new governance model with one board, one board that has obviously a very close working relationship with the Department of Health and Wellness, but has accountability and responsibility for delivery of all healthcare services for all 3.7 million Albertans. It's the largest healthcare delivery service in Canada. It is about the 5th largest employer in Canada. This, if you looked at it in a corporate governance perspective, it is the largest, most complex corporate merger in Canadian history. All that while trying to ensure that we don't drop the ball in delivering healthcare one by one throughout Alberta. And as you would expect, not all of the former regions and organizations had the ability or the expertise on their boards that were sort of aligned with best practices for governance that you might see in the private sector, for example, although you don't see it always in the private sector either. And of course, governance is not exactly the sexiest issue, but it is really necessary as a foundation for sustainability, for transparency, for accountability, and of course, most salient to the discussion here today and tomorrow, for innovation. Good governance is a really fundamental element, creating the environment for innovation. So clearly the board saw it had a really important guiding role in guiding human performance, setting the new strategic direction for the new organization. We put in place risk management tools, including an internal audit function, which, if you're an accountant, any accountants in the room? Didn't think so. There aren't usually at healthcare gatherings. But it's true. We have not, as in the healthcare world, actually spent a lot of time to how we actually spend resources. So our greatest challenge was to say, you know, we spend $11 billion delivering healthcare in Alberta. How do we do that as effectively as we possibly can? That was one of the goals that we set out to try to accomplish, because a dollar wasted at the back end is a dollar wasted. It's not it's not used for delivery of healthcare services at the front end. And frankly, in the first full year since the creation of Alberta Health Services, that is, it wrapped up last April, 1st of April, we captured $500 million in savings on the back end from things like payroll, how you do payroll, how you procure stuff, drugs, etc., and administration, half as many vice presidents now as we had before. One at CEO. Well, we had one last week. We have one acting one this week. We had 12 when we started. You know, and all of that while working in what we call the virtuous triangle, the Institute of Corporate Directors. I learned the way to articulate this, sort of the virtuous triangle, which is that space where you've got the mandate, public policy, and politics. It's kind of like the virtuous circle, except it's got sharper edges. Making real change, transformational change, requires strength and alignment in all three of those areas. And that includes mandate, public policy, and political will. And since there's no public policy issue more personal than healthcare, that kind of alignment is difficult to achieve, but it really has to occur. I happened to meet the fellow who ran the National Health Service for Tony Blair in the summer in the UK for 6 years, Nigel Crisp, Lord Crisp. And the way that they were successful there in ensuring that they had 4 hours wait times in all of the emergency services throughout the UK. This is a goal they set, and they were going to pay the price in other areas, but they were going to achieve 4 hours for emergency wait times throughout the UK, and they got there was because they had complete alignment. Prime Minister, Secretary, and the CEO of the National Health Service. And that was absolutely critical to them being successful in achieving that. So for us, it's a work in progress, as it is in much of the Western industrialized world. I'm sure you've seen the coverage, in the news coverage about Alberta Health Services over the past week or so. I'll give you the 30-second version. We had a CEO 2 weeks ago. Well, actually, last Tuesday morning, I left home in just outside of Calgary. It was 37 below. I flew to Edmonton. We had a CEO at the time. We had a board of 15 members. And by the end of the week, it was above freezing in Calgary. The CEO, we had agreed to separate our relationship with the CEO, Dr. Duckett, who's a very talented man in a very difficult circumstance. It would appear we've got a board of 9 or 10 members today. So it was a very interesting week from the perspective of leadership and governance. And I had a half-hour news conference on Thursday afternoon, and one of the media said, there was almost this number of people, it seemed, at the time asking questions. One of the media representatives said, what does this say about Alberta Health Services, the fact that you've lost your CEO and there are other concerns and possibly members of the board resigning? What I said was, well, what it says is that leadership in healthcare is extremely difficult. And that's true in Alberta, it's true here in Ontario, it's true throughout Canada and in most of the Western industrialized world. This is not easy stuff that we're all trying to do. This is difficult stuff. And we're trying to make the best use of resources. The resources will always be limited, and there will always be lots of competing interests for how those resources are allocated. So the board itself, though, has a pivotal role to play in the stability and the sense of focus in the organization. And from our perspective, we're moving on. We're moving forward. We have a team in place. We have a plan. We have a budget. We have a leadership team committed to that plan. Obviously, I deeply respect. We had around the board table a group of people who, all of whom deeply respected each other and continue to. And I respect their decisions not to stay on the board, just as I know they respect my decision to look into my soul and say, how can I be true to myself, and can I still contribute here? And my conclusion was that I could. We clearly have work to do in terms of public engagement. Every healthcare delivery service does. We have 4 values in the strategic direction document that we build our organization upon. Engagement is one. The other three, respect, accountability, transparency, also speak to the needs to be able to communicate and connect with Albertans. We've established health advisory councils made up with volunteers throughout the province who help us in this respect. We also, as you know, you can't improve what you can't measure. There's great work going on to ensure that we actually can measure what we want to measure, because today, as I'm sure would be the case in any other province in Canada, you can't always measure what's relevant. You can measure a lot of stuff. You can't always measure what's relevant. You can't always get the data on what's really useful to help you manage the system so you use your resources more effectively. In our case, we've put in place pay at risk for the senior management team. That means if they don't achieve their objectives, these by and large objective measurements at the end of the fiscal year, they don't get their pay at risk. That was an innovation that we put in place that you'll see in some parts of the public sector, but not all. But we see it as an important governance mechanism to drive improvement and innovation, affixing a portion of the potential compensation of senior executives to certain outcomes. And then they have to figure out with their teams how to get from the goal to the outcome. We also, another innovation that we were able to undertake in Alberta was to have a full and frank conversation with the provincial government about a year ago. And the end result of which was that we have been provided with a 5-year funding plan. We felt stability was incredibly important, particularly after the changes that we had all collectively been through, that no organization thrives on continual turmoil and change of leadership and change of plans. And so we've established, the province has given us, it's probably the only jurisdiction, again, in the Western industrialized world, where they can actually live up to a 5-year funding commitment and are prepared to make it. And every month that goes by, that 5-year funding commitment looks better and better to me because others don't have it. There are many aspects to governance. There are many aspects to leadership that are absolutely critical in the healthcare sector. We've got our own path that we're on in Alberta. We watch other parts of the country to see how you are making out. We're happy to share with you our experiences. I wouldn't recommend all of them, but there are some good experiences, hopefully, that we can collaborate with other parts of Canada on as well. Clearly, innovation is one of the most important aspects of concern to me as chair of the board. You know, large organizations, Alberta Health Services has 90,000 employees. How do we ensure that we continue to have the kind of innovation that the best kind of innovation continue? And so we have to be particularly attentive to ensuring that we create a culture that is welcoming, that is open, that we cut away the underbrush when you've got new innovations, about some of which you'll hear about tomorrow here today. And what can we learn from that process in terms of ensuring that innovations don't get stifled by bureaucratic processes that grind you into the dust. The Ivey Centre for Health Innovation and Leadership is a very, very important institution, and I commend all of you for being part of it and for the leadership to create it, because of one of the things I have observed about healthcare is that people get into healthcare for the right reasons. There are a lot of people who are deeply committed to their own part of the professional matrix that we all belong to. But we really need to build our capacity for leadership, for senior management capacity, for ensuring that we enable innovation within the system and then share that with others. So I want to thank Kelly very much for the opportunity to be with you here this evening and then again tomorrow. And I wish you all well in your hard work to help provide leadership to healthcare in Canada. Thank you.